Now, moving to the next type of fractures here, and we're looking at the fractures which are known as the supracondylar fractures. Supracondylar fractures. So, here we have to classify them. So, they're into different stage, or you could say types. Type 1, type 2, type 3. So, we'll just define all of them. It's a very good exam question as far as the upper limb fractures is concerned. And it's good for you to always know the types of fractures around the supracondylar, side. So supracondylar fractures, if you want to classify them, the standard of classification is what is known as the Gartland system. Okay, so this is based on the degree of displacement, what you see on X-ray. Okay, so this is physical, but you don't have to tear the patient up to see this. No, you can just view it on X-ray. Okay, so we have the type 1, which is undisplaced fracture. There's a fracture, but nothing is scattered. Everything is still intact, but there's a line, you know. So it's stable, usually treated with immobilization. They just cast or splint you for a while, you know. They'll have the type 2, which is what? Displaced fracture. But the posterior, that's at the back, is intact. Okay? So maybe managed with close reduction and casting or pinning, depending on the stability. They'll have the type 3. Okay, it's completely displaced fracture with no cortical contact. It's very unstable. Always requires what? Surgical fixation. That's what percutaneous pinning. They'll have the type 4, which kind of like was newly added to the system. Here you can see that it's only type 3. But here they have type 4, which was added later. And the fracture is unstable in both flexion and extension due to complete periosteal disruption. Highly unstable. So they have to do extensive operation for such a type. Okay. So this is another summary of the Gartland classification system for supracondylar fractures. So clinical insight is type 1 are least dangerous. There's minimal risk of the blood vessels getting injured, nerves getting injured. Type 2 fractures carry a risk of malunion if not properly reduced. Type 3 and type 4 are the most serious. So there's a lot of risks of what? A lot of blood vessels getting injured and also the nerves getting injured. So that's what we have for the classification for supracondylar fractures.